Good evening, everyone. I'm Ms. Murugathas from Faculty of Allied Health Sciences, University of Jaffna, Sri Lanka. I'm here to present my paper on the title Knowledge and Practice Regarding Usage of Sublingual Glyceryl Trinitrate. First of all, I would like to give an introduction regarding the cardiovascular diseases because these diseases are nowadays the leading cause of death globally, and they are caused by the disorders in heart and blood vessels. Among the cardiovascular diseases, the ischemic heart disease is the major one, and it shows the manifestation of chest pain, which is also called as angina. And for treating this anginal pain, the organic nitrates are recommended, and among them the sublingual glyceryl trinitrate, it's also called as GTN tablets, plays a major role because the effective self-management of cardiac symptoms by using these GTN tablets will definitely enhance the good quality of life. So while I'm studying in the undergraduate degree program, I got the chance to visit the hospital pharmacy practice, and there I have noticed that a lot of patients are struggling in gaining the knowledge. Even the physicians or pharmacists are playing a major role in giving their knowledge. But also the hospital displays the drug details and everything on the clinical setups, even though the patients are not much knowledgeable. So this motivated me to check whether the patients are having the knowledge or not regarding these drugs, because the adequate knowledge and the proper practice regarding these GTN tablets will play a major role in management of angina. If the patient is having inadequate knowledge regarding this, they will fail to call for the help when they are urgently needed, and if they miss the help, it will definitely leads to an unnecessary death. So assessing the knowledge and practice regarding the GTN will be very much beneficial in avoiding the complications, and as well as we can go and identify the learning needs of the patient through the results. So the objectives of my research is to assess the knowledge and practice regarding the GTN tablets and describing the influence of socio-demographic factors on the knowledge and practice. So here I'm going to give a brief introduction regarding the methodology. This is a hospital-based descriptive cross-sectional study where I have chosen the cardiology clinic at Teaching Hospital Jaffna as the study setting. And the study population were the patients who are attending there and receiving these GTN tablets. And they were recruited in a systematic sampling technique to my study. So first of all, I have developed an interviewer-administered questionnaire in English and thereafter translated it to the native languages like Sinhala and Tamil. And this questionnaire contains 3 different parts, A, B, C, where the A contains 6 questions regarding the socio-demographic factors, with part B having 13 questions regarding knowledge, and part C finally having 10 questions regarding the practice on GTN tablets. After completion of their research proposal, I have submitted this one for the ethical clearance to the Ethical Review Committee, Faculty of Medicine, University of Jaffna. And after gaining the clearance approval, I have got the permission from the director Teaching Hospital Jaffna and proceeded with the data collection. And during the data collection, the privacy of the patient was ensured. And after the completion, all the data were entered and analyzed using the SPSS 22. And before doing the analysis, we have already given a predetermined cutoff value for assessing the knowledge. The knowledge part of the questionnaire totally gets 20 score, and the score between 11 to 12 were categorized under the good knowledge, and from 0 to 10 were categorized under poor knowledge. It means 50% was given as a cutoff value for assessing the knowledge. And here you could see the result part of my research study. According to the participants, I have got 95.5% of response rate with a mean age of 66 years with standard deviation 9 years. Here I have mentioned only 3 socio-demographic factors because I have did the research in the Jaffna, the district Jaffna. So the most of the participants were Tamil with a religion of Hinduism, and almost 90% of them were married. So I thought that it won't play much role in assessing or identifying the influence of socio-demographic factors on the knowledge part. So according to the results, I have got that the majority of the participants were male with an age of about 60 years, and they are studied under O level and up to the O level. Only here you can see that 11.3% of them have studied the A level, it means advanced level, and the further degrees. And while assessing the knowledge part of the patient, we were astonished because we have got a poor knowledge, 77.3% of poor knowledge on GTN tablets. But surprisingly, 94.1% of them knew that they are taking GTN tablets in order to relieve the chest pain. But unfortunately, only 6.6% of them are aware that the drug can be utilized as a prophylaxis manner, and nearly 7% of the participants knew the actual mode of action of the drug. Then we have raised questions regarding the administration of the drug. So most of the patients were well aware that the drug should be kept under the tongue because it is a sublingual glyceryl trinitrate. Sublingual means we need to keep the tablet under the tongue. So they were all well aware on that. And also they knew that the drug should be taken in a sitting or lying down position, and they have already practiced that one. At the same time, while asking the questions regarding the maximum number of tablets and the interval, nearly less than half of the participants only correctly mentioned that 3 tablets should be taken with an interval of 5 minutes for a pain episode. And the if even after the administration of 3, that means the maximum tablet, if the chest pain is not relieved, they should go and seek the medical care immediately, but they were well aware on that. Then moving into the storage portion, nearly half of the patients showed that they have replaced their drugs for every 8 weeks once it is first opened. But all of them, nearly 100% of the patients have kept their drugs in an amber color bottle in a cool and dry place, because GTN tablet is very sensitive to light and body heat. If we have kept in a direct sunlight area, the potency of the drug will be reduced. And the major part regarding the drug is the drug interactions and side effects. Nearly 38% of the people only knew that it causes headache and weaknesses and nausea, but only 20% of them knew what to do in order to eliminate these things. Even while administering the drug and the chest pain relieves, we can spit it immediately in order to avoid the side effects, as well as we can go and take rest in order to remove the side effects. So only 20% of the people are aware on that. And the most important thing is the usage of sildenafil, or the famous brand Viagra. It is contraindicated with GTN because both of them will cause the vasodilation. But here only 1.6% of the people were aware that it should not be taken together. So it is a mass finding here, because it is all the people should know this one in order to eliminate the side effects. And by assessing the socio-demographic factors together with the GTN knowledge, we found that education of the participants, especially those who have studied more than O level, have got good knowledge when compared to the others part. And when saying about the practice of the patients, we have found that 81.2% of the people are carrying the GTN together with them, because the physician as well as the pharmacist always advises the patients to take their drug together with them, because we can't predict at what time they will get the ischemia or the anginal pain. But here only 81.2% of them had correctly followed the advice. But we have asked whether while carrying the drug, are you protecting it from light? They said yes, but while checking the way they are carrying, we have found that 72.5% of them are carrying it in bag, but the remaining others are keeping it in the pocket. But keeping the drug in a pocket is not a good way, because the drug can be affected. The potency of the drug can be affected by the body heat also. So it should be avoidable. And while assessing the practice, we found that only 4.3% of the participants had taken the drug while doing the exercises or before the hard works. And for the clinics, normally the patients are given a date for 3 month interval. And we found that 11.7% of the participants showed that their drugs are finished before their next clinical visit. And among them, only 70% have gone and received the drug from private pharmacy, while the remaining 30% have waited until the next clinical visit. So after that, we have raised the questions regarding the receiving of information, and there we found that the physician and the pharmacist plays the major role in providing the drug related information to the patient. Thereafter, we have compared our studies with other studies and found that the majority were male in our study, and it was very much similar and in line with another studies which are done in other parts of the world. And at the same time, we have got a similar results that the 22.7% only got good knowledge regarding the GTN tablets in our study, and it was almost similar to another study which was done in Malaysia where it is 22%. At the same time, we compared the administration of drug with another studies, and we found it was very much closely related to a study was done in Australia, but it was deviated with another study where the percentage is 69.0. But the way of carrying at this also the carrying the drugs together with them all the times, and those things were very much similar to another study, and I have mentioned the reference there. So after assessing the results and going through the discussion, we found the conclusion that our study showed only 77.3% of the participants with poor knowledge, and the education level was significantly associated with the level of knowledge, and almost a significant number of participants are carrying the drugs together with them. But the important thing here is the GTN tablet is taken on an as needed basis. So much information is not even provided to these drugs, because whenever necessary only it can be taken. So the patients as well as the healthcare workers are focusing towards the other drugs when compared to GTN. So giving a frequent reinforcement of patient education will be beneficial in increasing the level of knowledge. So here I have mentioned some recommendations. Normally the patients are visiting alone to the clinics and everything, but while giving the advices regarding GTN, it is beneficial when we have their family member or spouse together with them, because when they get the anginal pain or heart related symptoms, if another one is also very much knowledgeable regarding the drug, it would be helpful for the patient to get relief from the chest pain. At the same time, the patient should be clarified properly regarding the heart attack signs, because sometimes they may complicate with the gastric symptoms also. And finally, I recommend to give a written information together with the verbal information in order to increase the patient knowledge, because every patient have different level of understanding and knowledge. So giving them the way how they grab the more knowledge is very important in improving the knowledge. And finally, here I have mentioned some of the references that I have used in the PowerPoint presentation, and there are more references there, and I have utilized that, but only 3 references I have mentioned here. And finally, I would like to thank my supervisors for supporting me to do this research, and also I give my profound gratitude for the entire conference team. Thank you.
Thank you, Thanujah, for your presentation. So
Thank you.
now time for the question and answers. Is there anybody there?
Dr. Nikita? Thanujah.
Yes,
Thanujah,
yes,
you have done very good presentation. The way you present the slide is very nice.
thank you, ma'am.
Your results and discussion part is very clear. So as per your results, it's around 70% of the people has poor knowledge
Yes,
in
ma'am.
using. So what are the measures you have taken to improve their knowledge
So
as a pharmacy student?
through the supervisors, we have informed the results to the director as well as the pharmacy workers there in the hospital. And
Okay.
we have told that if we are providing any leaflets or the posters regarding the drug, it would be beneficial, because for the most of the time in receiving the medication, they wait in the pharmacy area. So if we are providing any leaflets or the posters, they would read it and get some information. So we are planning to do that one.
Okay, what's the sample size?
My sample size, I have through the proposal I have given it is as 402, but for the research I have approached through 258 and 246 is my final population.
So is it a right way to reduce the sample size from the proposal to now?
No,
Data
exactly it
collection.
is not, but I have did this research for my undergraduate as a portion of my undergraduate degree. So according to the advice of the supervisors, and the data collection time was given as 1 month only. So in that period, I could collect these amount of samples only.
Okay, what tool you have followed to collect the data? What's the standard tool?
Now, I have developed the questionnaire by my own with the reference to the literature reviews and everything. Thereafter, I have validated it by using, by getting the advices from the consultants, 3 different consultants from cardiology clinic. And thereafter, finishing the validation only, I have used this.
Is there any standard assessment tool for measure this knowledge?
But for the adherence, we have the standard tool. But for the knowledge, I have used the this method only, ma'am.
Okay, okay, thank you.
Thank you, ma'am.
Thank you, Dr. Vijita.
Okay,
Okay.
ma'am, you carry on.